Food allergies impact nearly 1 in 10 people across the country.
That means you or someone you know probably deals with this on a daily basis.
But for minority communities, food allergies could be a bigger problem that often goes unaddressed. All new tonight, we take a closer look at why that's the case and what's being done to fix it. It's a buzzing and bustling scene at Clinton Elementary in Sherwood. For many of these students, lunchtime is their favorite part of the day. But behind the scenes, cafeteria workers are working diligently to make sure lunchtime doesn't turn into a disaster.
We want to serve them good, healthy food that they'll eat.
Regina English is the director of nutrition for the Pulaski County Special School District. She says nearly 200 students have reported having some sort of food allergy. More than half of them are minority students.
We've had 2 occasions to where that child has ate a sunflower seed without knowing that they are allergic to it and taken to the hospital.
While a situation like that is uncommon for the district, it's not always so rare outside of it. Researchers and doctors report that food allergies affect about 11% of adults and 8% of children in the U.S., totaling around 32 million Americans.
Difficulty breathing, they can cause severe abdominal pain, cramping, vomiting. They can actually cause you to pass out.
And while food allergies can affect anyone, a study last year found that minorities are reporting at a higher rate, specifically Asian, Black, and Hispanic communities.
People that have family members that have food allergies or other allergic disorders may be at slightly higher risk of their newborn developing food allergies. We also know in minority populations, unfortunately, we're less likely to be referred to a specialist for a proper diagnosis as well.
Dr. Tamara Perry is the chief of allergy and immunology at UAMS and Arkansas Children's Hospital. Experts like her are also exploring different environmental factors that can impact food allergies, like air pollution. The study we looked at calls for additional research to find answers and call for, quote, more targeted, culturally relevant, equitable, and accessible educational efforts.
They can be life-threatening, and without a proper diagnosis and treatment plan, people don't really know how they're going to react.
They feed over 700 breakfasts, over 700 lunch.
That threat of allergic reactions is front and center for Stephanie Walker-Hines, Director of Child Nutrition for LRSD. She says with a large demographic of minority students, they try to keep allergy trends in mind when selecting and serving food in their district.
If it's going to be a disability for a child, we're going to accommodate it.
The district is also taking this a step further by inputting food allergies into their system to help limit severe allergic reactions.
And then their allergen pops up and that cafeteria manager and or the cashier will see those things.
If we know the children have food allergy by way of a physician's statement, we enter those allergies into the point of sale, and then each cafeteria manager at each school is charged with making certain that child does not get what they're allergic to.
And it's not just school districts and physicians doing their part to help raise awareness. National organizations like FAIR, or Food Allergy and Research Education, are working on the front lines too. They've developed a program called the Fair Neighborhoods Initiative to support people facing food allergies in historically marginalized communities.
Not only is it difficult to access enough healthy foods, when you add on shellfish allergy, peanut allergy, milk allergy, it can be very difficult to access safe foods.
Little Rock is one of 6 cities they're offering this initiative because of reasons like poor access to medication, allergists, and safe food.
We're looking to train stakeholders at food pantries or soup kitchens, as well as community leaders like community health workers, so that they can teach and enable families facing food insecurity when there is limited access. How do you create healthy, safe, and affordable meals for your family despite having food allergies?
Now, the allergy study we looked at showed peanuts was the highest and biggest problem for Black children. Asian children reported higher rates of tree nut allergies, and tree nut allergies were highest among Black adults. For Hispanic adults, egg and fish allergies were highest. Now, household income also had its place in this study. The survey found food allergies were most prevalent among households earning $50,000 to $99,000 per year. As for the work to fix this issue, FAIR says it's ongoing. Through their Neighborhoods Initiative, Little Rock will have its own community health worker who will focus on these issues. There's also an event to increase awareness coming up with FAIR, UAMS, and their culinary medicine program during Food Allergy Awareness Week. That will take place May 12th through the 18th at the 12th Street Community Center in Little Rock.
Interesting stuff there, Faith.
Yeah.
It's interesting because I know growing up with me, you might know one kid
Yeah.
in school who had that peanut allergy, and it was all very dangerous, and it's amazing to see how much it's expanded.
Yeah, since about the last couple of decades, research shows that overall food allergies have gone up by 50% in the last couple of decades for everyone. So it's very interesting to follow those numbers.